Because everything ran over tonight, we're so limited in time, we'll have our guests back shortly. Congressman Paul, did the president change your mind in any way tonight?
No, not quite. He firmed up my beliefs that there's no way this will be paid for. You know, at the end of his speech, he said we're not going to have $1 of debt coming from this. But there's never been a medical program by government that wasn't 2 or 3 times more expensive than they claimed it would be. So he said it was a little under $1 trillion. I predict when this is all over, it'll cost $2 or $3 trillion. And believe me, he said, of course, he wasn't going to take any money out of Medicare. Well, he couldn't. It's practically broke itself. I mean, all these government programs are essentially bankrupt. So I don't see any practical outcome from all this proposal. This is just going to move the bankruptcy of this country rapidly along.
Dr. Shiner, you're a strong proponent of a national health program involving the government. Do you think you're going to get it?
I think it's still possible, but I think physicians are going to have to organize to get it. $400 billion a year is spent on private health insurance administration. Under his program, this will probably increase. It's going to be, a third of every dollar spent in health care. The other thing, he dismissed single payer very quickly, saying if we shifted to single payer, this would disrupt health care. A patient who's 64 is on private health insurance, turns 65, there's no disruption in health care. Private health care interferes with the practice of medicine constantly. I had an example in my office today, which was a disaster. Medicare never interferes. The health lobby has spent $250 million in lobbying over the past 6 months, and I think they're getting their money's worth if you watch the Republicans tonight. I'm ashamed.
Dr. Nielsen, where do you stand in all of this?
Well, we think he set the stage for significant health care reform, and we think it's time to seize the opportunity. People are suffering in this country. If we didn't need insurance, it would be fine if people didn't need insurance and we went back to the old way where patients just paid their doctor, but that doesn't work when your daughter gets leukemia. We really have to share the risk, and so he set the stage. We are hoping that people of goodwill on both sides of the aisle will really get down to work and recognize that we need to get something done, come together, compromise, and get some meaningful reform.
Are you saying that the AMA generally approves basically of his ideas?
Well, if you think about it, Larry, what he did is he set out 3 major goals. One of them was to stabilize those who have insurance right now. That's a laudable goal. He said the second goal was to provide affordable health insurance for those who don't have it. There aren't many people who would disagree with that. And the third was to stem the rising health care costs. And again, as a country, we have to do that. But if you remember, the one area where he got this laughter in the that got a reaction.
We are. Thank you all very much. We're out of time. We're going to do a lot more on this tomorrow, and we hope to have all of them back.